welcome, and thank you all for being here, for welcoming me. I appreciate it a great deal. You know, the program that you obviously are all involved in is a great program for a few reasons, I think. You know, obviously we have a need for more people trained to deal with substance abuse and to try to help people get back on the right track. And so to have a program like this that Labor is working with nonprofits and the private sector is really important. But also just in general, to be here, this is kind of where I started my public service career. It seems like a really long time ago, because it is. 22 years ago, when I was a Morris County freeholder, my area of responsibility for my first 2 years on the board were human services. And so I spent a lot of time up in this complex, between the youth detention center, and it was during our time that we gave those buildings the daytime, and all the cluster that we have here. So I think I understand better than most about how important what you do is, how important it is to be integrating. One of the things I love about this program is the integration between mental health type of treatment, the other treatment that folks need. We can't keep these things separate. We know that so many folks have the co-occurring issues of mental health issues plus substance abuse issues. And previously we've just dealt with them separately, as if they're not interrelated. We know they are. And we know that people need to be treated in a way that deals with both those sets of issues, or we can't give them the success they need to move on, to get their own housing, to get their own employment, to be able to be productive members of their own families. And that is all extraordinarily important. And what you're doing here helps to do that at Home Solutions, folks in the Mental Health Association. You working together is incredibly important. And that's one of the reasons we're moving the Division of Mental Health and Substance Abuse to the Department of Health. We really believe that if we're going to do a whole bunch of commercials, which we've done, saying addiction is a disease, well, it's the only disease we treat in the Human Services Department. All of our other diseases we treat in the Health Department. And I think having the Commissioner of Health be able to access the resources that she has at the hospitals across the state, who you know need to be bigger participants in this, in every aspect, both in terms of mental health treatment and substance abuse treatment. The ability to be able to leverage that is going to be, I think, really important. And that's why we're doing what we're doing in that regard. And, you know, whenever there's any change, there will be someone who doesn't like it. Like,
of course.
You know, I was talking to you about, you know, Essex and Morris County merging the mental health associations. You can be guaranteed someone, lots of people don't know what it's going to be like, and you can be guaranteed that some people won't like it. But in the end, what we have to be worried about and concerned about all the time is not public perception, but results.
Yes.
What results are you producing for the people who are in your care?
Yes. Yeah.
And in the end, none of us are in the business I'm in or the business you're in to get rich. And if we are, we're going to be surely very disappointed at the end of it, right? Or going to jail. One or the other. You wind up getting rich from these jobs, right? So the point is that we do this because of the satisfaction that the work brings us. Well, we can't worry about people's perception of that. We got to worry about the people who are in front of us.
Yes.
And you know that those folks come to you often at the most desperate, lonely, hopeless times of their lives. And so I've always viewed folks in this business as people who are angels here on earth. You know, people don't just need salvation when they die.
Yeah. That's what
We hope we give them salvation before. And what you all do and what all these folks are working with Labor to train to be part of the system is to give people hope and give them a pathway to deal with their substance abuse issues, to deal with their mental health issues, to get them the right medication if that's what's necessary, give them the right counseling, and then when they start to show progress, to give them the opportunity to have a real full life. the opportunity for housing, give them the opportunity to get a job. All those things are really, really important. So I'm really happy to be here this morning. I'm going to shut up now and let you talk to me about the stuff that's on your mind. But it is, I want to thank Aaron. You know, most people don't think that the Department of Labor, their normal thought wouldn't be, the Department of Labor is going to be involved in helping solve this substance abuse issue in our state. But we know that we have to use every different lever of government that we have because there are just too many people dying.
Yes.
In the first half of 2016, the Attorney General is going to announce this later today. In the first half of 2016, 1,000 people died in New Jersey of drug overdoses. In the first half of 16. You know, and this combines with looking at the deaths in the United States in 2015, which were 52,000 across the country. That means that now it is a greater cause of death than gun homicides and car accidents combined. And that now, in our country, drug overdose is the single largest cause of death in men under the age of 40. Think about that. The single largest cause of death for men under the age of 40 in the United States is not cancer, it's not heart disease, it's not gun homicides, it's not automobile accidents, it's drug overdoses. And so we're in a crisis that we know, and you all know because you're involved in the center of it, that fentanyl, carfentanil is going to just make this crisis worse before it gets better. And so we need to be prepared to do that, and this program helps to do it. What you guys are doing every day helps to do it. So Wes, why don't you let me know, who should we talk to here, and what do folks want to say?
Well, first, before I turn this over to the CEO, Dan Dwyer, I want to thank
Hey, smart
you.
guy. There you go, Wes. How would we say anything other than turn it over? Big future you got, Wes.
But I want to thank you and the commissioner for coming. And with that said,
Well, and I'm going to hit the ball back to Wes in just a moment, but again, I would like to thank you, Governor and Commissioner, for being here. On the brief time we had on the way up, the Governor was asking some very good questions about how many people we're serving, and as he noted here, results. What kind of results are you getting? And Wes had explained that in the last year we had served more people than the year before, and the reason for that primarily is the success of our case management and our partners in moving people out more successfully, because we still have we only have 85 beds here. That never changes, so it's not adding beds, it's better results, the success. And we're focused on helping Morris County, which achieved a 9% decline in homeless households last year in the point-in-time count, which was a big success. We're committed to helping them build on that in this year and the coming year. We're adding 22 units either through acquisition or construction over the next year or so, and those will all be targeted to homeless households to help reduce the number. But the other way we achieve the success is by meeting people where they are here at the shelter when they come in for help. And this new partnership that's evolved is really exciting to get even better results. And that's where I hit it back to Wes. You can talk more about it. We're really excited.
So I just want to very quickly, before I open it to everyone at the table, I just give you a little insight into how this all came to be. So I was conversing amongst my staff about the epidemic and what's going on with the people that we service, and we all said we have to do something. So we reached out to our administrative team to say, is there any money out there that we can find to get our staff trained in this drug and alcohol certification. So we were lucky enough to be awarded $15,000 via the Providence Foundation. So in turn, we took that money and went to CCM, and Beth Jacobson was gracious enough to work with us. I was hoping maybe 2 to 3 people would be certified. Beth took it. It went to the Department of Labor and Workforce Development, which they graciously accepted as a pilot, to serve as a pilot program for the state. We reached back out to MHA. We have a long standing relationship, Mental Health Association of have to stop doing that.
That's all
Reach
right.
out
It's
to
still
them.
a major. It's
Right.
okay.
And we said we've had this long-standing partnership. Let's continue it. Our Safe Haven program that I mentioned as we were heading up, approximately 70% of the people in that program are dual diagnosed, meaning they have a mental illness and abusing substances. So we said, let's get together and let's partner so we can do something in-house to make a change. And Rutgers and Padma and her team got involved to make sure that everything met the state requirements. And here we are now, approximately 6 months in.
Yes.
Pascal? Pascal is the instructor, a
Hi,
wonderful
how are you?
instructor for the first few domains. And it's exciting because we're going to be able to do something in-house. There's just not enough treatment in Morristown to meet the need. And then when we do find somewhere, the wait list can take up to weeks, and we can't afford to lose someone and wait weeks to get treatment. So now with this, with having staff in-house here at Homeless Solutions, and then with the Mental Health Association, we can address the need.
That's great. Really good. So who wants to tell me something I don't know?
Well, what I'd like to do is Catherine.
Sure.
Catherine is a participant in our Safe Haven program.
Great.
Good morning. Good morning, Governor Christie.
Good morning, Catherine. Welcome.
Thank you. My name, well, there you go. I am that dual diagnosis you just spoke of. I have addiction and mental health issues for 15 years. I had a beautiful life. I lost everything to drugs. My home, my family, my friends, literally everything. It all started with a slip and fall accident. I got a prescription legally, and after I couldn't get the prescription anymore, I went to heroin because it's cheaper and easier to get than it is pills. I attempted to get clean more times than I honestly can say. You know, but right now I'm confident in my recovery, and I owe a lot of that to HSI. You know, I have been sober now a year, and I thank them, and I thank MHA as well, Mental Health Associates, for all their support. I couldn't have done it without both of you. I came to HSI in September 2016 after spending a month in rehab. I was referred to MHA, Mental Health Associates, for a health treatment and transition to Safe Haven program after being a resident in single women's program for up to 3 months. So I'm so grateful because the support I've received from both my case managers has led me to where I am today. I'm mentally confident, mentally stable, confident in my recovery, and for the first time going to be a truly independent woman. I have reconnected with my family, obtained my driver's license, and I soon will be moving out of HSI. Just got my place to MHA. I needed the structure and support of HSI, and I feel like I'm finally able to see. I admit I did have a lapse during my course of stay, and I was able to be linked to treatment. They were awesome. They continue to remain confident. I do believe a substance abuse treatment had been available from the door. I might have prevented this, you know. I don't know, but, you know, the care and support provided to case managers and staff definitely has been a major factor in my recovery. The care and support gave me the sense of comfort that I needed to have and no longer was like struggling by myself. I would talk to my case manager and staff who needed help and support me along the way. I found out my case manager was participating in the Certified Alcohol and Drug class. I immediately thought it was a great idea. During my stay, I've seen many people come to the door who are struggling with addiction. And as great as the case managers and the staff already is, I know the education and certification can only make this better. The opiate epidemic is real, and this training is better prepared to continue helping people and allow individuals to start substance abuse as soon as they walk through the door. I know I have the tools now to remain sober, and I'm confident that the next guests who walk through the store will be able to see, as long as they do what they have to do and, you know, be motivated, you know, and work the program. The difference between addiction and sobriety, addiction doesn't discriminate, and anybody can get addicted without even like knowing they're getting addicted, without warning. Sobriety, on the other hand, you have to truly want it in order to have success at it. So in closing, I would like to thank the Homeless Solutions for giving me this opportunity to speak to you.
Thank you. Congratulations for where you are today,
Thank you.
and congratulations for being awake tomorrow and having
Yeah.
another great day ahead of you. And
Thank God.
I really think so much of what you said in there is so right. And folks around the state and around the country need to understand that addiction can happen to anyone.
Without even knowing it.
Yep.
Like, I was got pills and I had no idea that I was going to be addicted. So when I went to rehab, because they told, like detox, because my doctor told me that's the only way I would be able to get off of them. So I went to my first detox, and I thought I was better than everybody else. I'm like, oh, you know, I got my pills prescribed and did it. And then we were doing a test and they separated everybody. And like, okay, you go with the heroin people. I'm like I was so taken back by that. And then a year later, here I am showing heroin. So, you know what I mean? So it is very easy to fall into that.
Yeah, it really is. And, well, you know, people should know the statistics in this country now are that 4 out of every 5 new heroin addicts started with a prescription of opioids
Yes.
that
And
they
they started
obtained
with
legally.
kids.
Yep. Oh, yeah. So, you know, this idea that somehow this is some moral failing, you know, lots of people, because of the way their brain is wired, because of the way their body works, they get that first bottle of pills and they are on a descending slope from there. And the irony of it is just doing what your doctor told you to do. Right? You had some fall, you had pain, and they gave this to you. You took the pills like they told you to take them. And then all of a sudden, you're in a situation where you're finding yourself losing control of your life. And so I'm just so happy to hear that you're where you are.
Yes.
And the best word I heard you say in that entire talk was confidence.
Definitely.
And
And I
how
couldn't
great is
do
that?
it. I couldn't have done it without these people.
No.
They were awesome.
That is great.
Even when I had my relapse, they were awesome. You know, I can talk to Elizabeth anytime. And Wes, they're always here. They're always available for me.
Great. Congratulations on your success and your confidence.
Thank you, Beth.
Both are really good things.
Thank you so much.
Thank you.
And then before we reach out to the other case managers here, I am a man of my word. There is a program participant who wanted to come and speak to you today. She couldn't get off of work, so she wrote this letter and attached this picture to you, and I promised her that I would give it to you.
Got it.
So I am doing it.
Excellent.
Please.
And is there a way for me to get back to her? Is there like some way I can get her? After
Yeah.
I read it, just let me know how I get in touch with her. Let her know I read it. So.
Absolutely. Thank you. Thank you.
Right. So who else would like to tell me anything? This is your shot. You're sitting around thinking, if I ever saw him,
I
this
think
is your moment.
Pascal Augustine, the course instructor, I'm from CCM, County College in Morris, which has a great program in addition to working with Padma and from Rutgers. One of the things, as we were talking, I think one of the things that we could probably do, if it's not being taught of already, is probably doing an educational piece for the doctors as they prescribe the medication to these individuals. Because as you mentioned, some people's brains are not wired right. And sometimes you think that, okay, I'm going to be prescribed Percocets or Oxys or sometimes benzodiazepines, and then all
Look
the...
up something in my book.
Exactly. It could trigger an addiction. Before you know it, you're using drugs, hardcore drugs. So from my years of experience working in different modalities of addiction, I've encountered individuals that have used, drugs after being in a car accident, 70-year-old females becoming a drug addict. That really turns their lives around. So I think that's probably a recommendation if it's not already on the table.
Pascal, that's a really great point because when we know that 4 out of every 5 new heroin addicts start on prescription drugs, one of the things we also know is that there is very little education that's given in medical schools around the country on this issue. And believe it or not, there is no continuing medical education requirement for doctors to get their DEA license renewed to write prescriptions for these drugs. And so, some doctors we know have bad intention and they're running pill mills, but that's the overwhelming minority. A lot of people, physicians, are getting folks addicted to this stuff out of ignorance. They just don't know any better. We have to teach them a different way to look at it. And unfortunately, one of the only places right now that get education is from the pharmaceutical companies who are making the drugs.
Exactly.
And I don't want to say that they're lying, but they certainly have a bias towards wanting to write more prescriptions, right?
Exactly.
So Governor Baker did something great in Massachusetts. We did it just in our most recent budget. That now requires all the medical schools in Massachusetts and now in New Jersey to give courses during medical school on opiate prescriptions and opiate management. We did it in the budget, just through budget language that said, if you're going to get graduate medical education money from the state, which all our medical schools do, well then you're going to teach this course or we're going to take your money back.
That's good.
And that motivates people.
Yeah.
This is about
We know
$50 million now, so they definitely don't want us to take that money back, so they'll do it.
good.
And I think we need to do this on a national level as well. I'll have some more stuff to say about that in the next week or two when I put out our report to the president. But I really think you hit the nail on the head. This addiction, people in our country still think that this addiction starts in some back alley with a drug dealer and a needle. This addiction starts for most people in a doctor's office.
Exactly.
Yeah.
And at a pharmacy.
Exactly.
And we need to work on that. So it's a great idea, and we're doing it in New Jersey now,
Okay.
and we're gonna see what we can do to convince the president to do it too.
Okay.
I just wanted to add a comment and a couple of other things about addiction in general. To your point and Pascal's point, we had been approached by Department of Health to create a webinar to educate all the physicians on opioid addiction, as well as on a couple of other things on pain management, and we are working on it at Rutgers through the Healthcare Talent Development Center. And I wanted to say thanks to Dr. Maran as well as to Dr. Fittner for the support through the Talent Development Center. I also wanted to say that this program is not just a pilot program here. It is a pilot program for the entire country. We started this as an apprenticeship program, and it is as of now it is getting approved to be the national model for the country to do the CADC program. And we are also working on a behavioral health entry-level educational program, so you can create entry-level people to go and talk about opioid addiction from high school level. How do you manage pain, like chronic disease management of pain without depending on drugs. So that is where the education should start, without depending on a licensing. So we wanted to start that education at that entry level. So we are working on it at the national level, and I wanted to thank you, Governor, for giving us the opportunity through the Talent Development Center. And that would be a biggest help because we will be doing youth ambassadorship program.
Great.
So I just wanted to express that, and that starts in New Jersey as a national model.
Thank
so
you.
just wanted to take this opportunity to inform you of that.
Well, thank you, and I'm really so proud of what Rutgers is doing in so many different ways in this regard. You know, Rutgers was the leader, is the leader nationally still on sober housing in their undergraduate school. You know, and is the model for so many other universities across the country now that are modeling what Rutgers did to set up for students who are in recovery, to be in a place, a safe place for them on campus, to have sober housing put aside. Rutgers has led a lot of things on the issue of substance abuse, and this is just another example of it. And I think the other part of this that's really important is the merger of Rutgers and UMD&J. This is another result of that, the synergies that are now created because you have the medical schools now completely a part of the Rutgers family. You all can share information, you can share ideas, and you have a place to implement your ideas now with real patients at University Hospital, at Robert Wood Johnson, and all the different places across the state. So I was so glad when I read about this that Rutgers was involved with everyone else, CCM, with the Mental Health Association, and people here at HSI. It's a great collaboration, and you bring a lot of expertise to the table and a lot of experience, and we're proud of what Rutgers is doing. So thanks for raising that.
I mean, thanks for funding us.
Happy to have done it. It's one of those areas, and I think you'll see more as we go forward.
Governor, one thing I have to do, I know you're short on time, but I have to introduce the people who are on the front line working
Please.
directly. So that's Elizabeth, Osmond, Danielle, Angie, Rose, and Christina.
Excellent.
And what I'd like to do is I'd like for them to talk a little bit about how even though we're still involved in this training, the impact that it's having on them and the work that they have been
Great.
doing so far.
Whoever wants to start?
I'll start. So since now that we're taking these classes, we're learning different ways of handling situations that we didn't know before. So we're able to implement, even although we're not done with the classes yet, we're still able to implement and use the techniques that Pascal is teaching us now in helping our clients. It's so horrible, like we were saying, the drug epidemic, clients, even clients that come here, they come in struggling with substance abuse or whatever it may be, and like Wes said, with having co-occurring mental health as well. And before these classes, it was so hard to be able to, just through education and workshops, yes, we go to those, but through this class, before this, it was very hard to speak with them and then say, well, you don't understand me, which is what we hear a lot.
The empathy.
Yes. So we hear that a lot. And now that we're in these classes, we're able to use those techniques. It's almost like we hear it less. So we don't hear it as much anymore. We don't hear, well, you can't relate to me. You don't know what I'm talking about. And just even some of the clients knowing that we're in these classes makes them feel safe.
Sure.
So even, when we do drug and alcohol tests, if they fail, they know that we're not here just to say, okay, leave. We want to help them. They know that we're getting resources and we're learning different agencies more than we've even known before. Pascal was just telling me the other day about the methadone clinic in Morris County that I never even knew existed. And I was like, oh my goodness, this is great. And then I all of a sudden started getting all these clients. I was telling Pascal, all of a sudden I have 5 clients out of the methadone clinic, but they've been clean for 2-3 years. And I'm like, this is amazing.
Yeah.
Where did this even come from? So it's not just about the techniques, it's about learning other resources to help these clients, because like we said, lack of resources for substance abuse, especially within Morris County. And that's something that we see a lot. So if we even just, like I said, educating us and learning different resources, meeting different agencies, it's so beneficial to our clients.
Great.
It's really good. Yeah.
Yeah, I'll just go ahead and say, I'm just going to extend my gratitude for having this program, because I'm Osmond Davis, by the way, and I'm the senior case manager of the Safe Haven program, and I've been working in the Safe Haven program for about 7 years, and the current factor, a lot of our guests come in and they struggle with substance abuse. It's more so disruptive to the goals that they're trying to attain. So with this training, we definitely could improve our numbers, our success rates, so to speak. Because a lot of times when we work closely with the Mental Health Association to get them stable on their mental health treatment and linked into services, but with us having this in-house, we could basically tackle it, as Catherine stated, from the door, and we will definitely get a better success rate. So I just wanted to say that I'm really excited, and the reason why I got into this field is to help people, and by doing so, by having this addition to my my experience, I think we could go places from there.
That's great.
That's good.
Okay, my name is Maria Rojas, and I'm one of the residential support staff. So I spend my 8 hours with our clients, or guests as we call them. And I think this training has changed everything about the way I thought about addiction and everything. Because when you're not inside this environment, you see everything like far from you. But when you're inside this environment, you understand that it's a real problem, that they need help. But if we don't have the knowledge and the resources to be able to help them, I'm probably many times when they come to me, I will just stay quiet because I don't want to say the wrong thing. And then to this course, these 6 months have helped me a lot to see how I can answer their questions, or how can I direct them to the right place. And there's some occasions where a couple of our guests, I do bond runs, so I have a lot of time to talk to them, especially when there is 1 or 2 guests in there. And I think we become for them a I think it's way like a family because they come and they tell us everything that happens to them every day. And I have one day one of the guests that he came to me and he said he wanted to go and drink again since being, I think, for 4 months without drinking at all. And he told me that he wanted to drink because something happened during his day. And I decided to use some of the techniques that we have learned, like motivational therapy, and telling him how important it was for him to stay sober and how bad it could be if he goes back to drinking and he will lose all his work and everything. And then the next day he came to me and he said, thank you, I didn't do it. And a week ago he told me he's been 6 months without drinking and sober. And he's getting his life together and I can see how his life is going great. So I think this was a great opportunity for us, especially for me, because I'm not a case manager, so I don't have the same knowledge and background that they have. And I want to thank Wes and Dan for letting me be part of the course or the training, and Pascal, you're being great with us, and yeah, since I work with them every single day, I think this is something that should be done everywhere where we have this kind of population.
It's great, Maria. It's really great.
So, for mental health, okay.
Yeah.
So, I'm Danielle Parrott. I'm the director of homeless outreach services for the Mental Health Association. So, we do see a lot on the front lines of people who are homeless, who have mental illness, and oftentimes we refer them here, and we work with Homeless Solutions collaboratively to get them into treatment. And to speak to, being on the front lines, we're the ones that usually end up trying to motivate them to even get to the treatment. So, having these skills is just invaluable in trying to get them ready to go. And they come to us on the worst day of their lives, and when their families have already given up on them, and then, like I was saying, we become their family. And with me being a part of this class, allows me to extend to the other clients of the Mental Health Association that aren't necessarily with Homeless Solutions, and the 8,000 people that we serve, and I can, by proxy, provide some education to my staff. So it really does extend a lot farther than just here. And we continue to do that, and we hope to continue to expand all of the addiction services that are available to our people, because it seems that there's an overwhelming amount, and there's not enough treatment, there's not enough beds, there's just not enough services available for the overwhelming amount that we're facing right now. And it seems like it's growing, and it's getting a little overwhelming. This is helpful because we're able to do it in real time. We're able to start implementing things right away, even though we're not done. We still can apply things right away.
You're so right. And if you're overwhelmed, imagine how, how those families feel, those individuals who, you're overwhelmed by the volume of need, and those folks are overwhelmed by the depth of their circumstances, and they don't know how to get out. It's really hard. So yeah, it is overwhelming us, and that's why we have to get a lot more aggressive about it. You're right. I'm glad it's helping. It's really good. And the idea that it extends well beyond these walls for you, and for other people that you're able to use those skills to help, is really encouraging too. Definitely a domino effect, which is nice.
Yes.
Nice.
So, thank you.
My friend Rose, how are you, Rose?
I know it. So, I just want to thank you for taking on this initiative. The opioid crisis, it's real. Mental health and substance abuse is real. And I believe recovery is real. And so, I think for us at the Mental Health Association, and partnering with Homeless Solution for over 20 years, we've been doing this, right, together. I think we see people when they're at their worst, when they hit bottom, and so they see us as angels and saviors to help them save their lives. And so for us, if the staff don't have the tools, if they're not equipped to help these folks, it's useless. So this class is providing the tools that the staff need to really help people from point A to B and C, and so that they could go on and be successful in their life. I always say, in our field, when we talk about fundings and so forth, we don't want people to be disabled or be on disability for the rest of their life. Our job is really to help people up, and so that they could eventually help themselves and become productive citizens in the community. But in all of our lives, sometimes you need a little help. And so I see myself, we're not in this business to make money. That is true, but we are here to help people that are less fortunate and are going through really rough time. And I thank you very much for really pushing this agenda to making sure that this is addressed. And I've seen you, you know, substance abuse, mental health, you know, the funding. I've seen you really put monies into the community, and I really want to thank you for doing that.
You're welcome.
Thank you.
We're happy to try to be part of the solution.
Yes.
You know, nobody's going to fix this by themselves, so I'm trying to do the stuff that I can do. And it allows you all to use the skills and the abilities and the passion that you have for what you do every day, which is real powerful. It's real powerful in people's lives, and you can feel it. And I've spent enough time over the last 8 years with clients to know just how important you are to them. Really important. So, a really good point, Rose. So, anybody else? Anything you want to add?
They've covered most of the stuff. My name is Elizabeth Ebling, and I'm one of the safety and case managers. I work alongside with Osmond. We work with mentally ill population. As Wes said, the majority of our clients come in and they are co-occurring. Taking this class with Pascal, who is absolutely wonderful, is teaching us new skills that we can put into effect right away and help get our clients the help that they need that before we may not have been as aware of. We can catch things before they happen. So if someone comes in and they're saying they don't need treatment, they've been clean for 2 months, and we can work collaboratively with their MHA caseworker and kind of coax them into going for treatment, and that has been very helpful. Our clients are great, they're just struggling, so we're trying to lift them up so they can eventually do it themselves without the help.
Really good. Well, I want to thank all of you for taking the time to let me interrupt your day. Just know that you've got someone in me who really believes in what you do. I absolutely believe in second chances for people. I believe in the idea that treatment is the only way for us to work our way through this crisis. Education is important so that people don't start. Interdiction is important to get the bad guys. But in the end, we have more people on opioids in this country than any country in the world. We had enough prescriptions 2 years ago to give every man and woman, adult, in this country their own bottle of 30 pills. 259 million prescriptions 2 years ago in 2015. And so this is not a problem that any one of us is going to solve on our own. And so every person around this table is a link in the chain to help pull people up out of the ditch that they're in. And, you know, my job, I hope, is to make sure that I bring awareness in the public, try to lower stigma, which you know is so hard. So hard in dealing with this disease. I'm waiting for that moment. I've said this a number of times to folks, but this is very much like AIDS in my recollection. And, you know, I'm waiting kind of for the Magic Johnson moment. You know, when there is someone or some event that humanizes this to people and say, wow, it can happen to them, or well, now I need to be part of the solution. I'm waiting for the marches. You know, remember back, and some of you, fortunately for you around this table, are not old enough. Looking at Maria in particular. To remember the marches on Washington and our major cities to demand that the government do something to try to find a treatment for AIDS. And it was men and women of every stripe and variety, every ethnicity, every sexual orientation, who came together and just said, this could happen to my family and I want it not to be a death sentence. I'm waiting for the marches. And I think one of the reasons is we haven't had the non-stigmatizing moment yet. And so part of the reason that we're doing the advertising campaign we've done, and we'll renew again this fall, is I think if we do enough talking about it on TV, to tell people addiction is a disease, to tell them that reaching out for help is a sign of strength, not a sign of weakness, that this can happen in any family.
Yes.
I can't tell you how many times, and I was so glad to hear that Catherine didn't say this today, which was good. Almost every time that I talk to someone who is in recovery, they say to me, Governor, I come from a good family. And I say to them, well, why would you think I would think differently?
Yeah. Oh, yeah.
But people believe, they've been conditioned to believe, that somehow if you've become a person with a substance use disorder, that it's because you came from a bad place, from a bad family, from parents who didn't love you or weren't there, or siblings who weren't good to you, or that you weren't a good parent.
Yeah.
We know this isn't true. And you look at a county like this county, right, which many people across New Jersey would say, wow, what could possibly be happening in Morris County? Right? What could possibly be happening in Morris County? Lots of education, lots of money, not a high level of crime compared to the rest of the state. They must have no problems out there at all. And I know that for more than 20 years, this has been a huge problem in this county. It can happen to any family, to any person, at any time. And then, man, are they loving you. Right? That's what we've got to get people to understand, is that you're folks who need to be admired and supported 365 days a year, not just the day when their life gets thrown upside down. And if we get to that point, I think we're going to have much more success even than we're having already. But in the meantime, you guys have to keep doing what you're doing. And we're going to continue to support it. I'm proud of CCM and the fact that they're willing to partner in such an aggressive way on this. And everybody's loving you, Pascal. You know? Everybody's talking about how great you are. So
It's always a good thing.
we may have to have a separate meeting, Pascal, to find out what you're telling all these folks, because you're obviously an enormous resource for people, and the folks at Rutgers and everybody else who's involved in it. So I can't thank Homeless Solutions enough. I mean, I think we're making real strides on homelessness in the state. All the statistics prove that, but that doesn't help the person who's homeless tonight. And this is the place they can come in Morris County and be put on a path back towards a life that they can feel good about, and that's productive for them first, personally, then next for their family, and then third for the greater society. Because, you know, when you start working and you're paying taxes and you're doing other things for volunteer organizations, well, you're building our state into a better place, piece by piece. But when you're suffering from mental illness that's not treated, when you're stricken by substance abuse disorder, when you don't have a place to live, when your family doesn't know what to do with you, people call that like a burden on the state. Well, it is, but that's the least part of it. It's a burden on your family who love you, and it's a burden on you. I believe that whether it's Catherine or any other of the clients that you have here now or have had over time, that each one of them is an individual gift from God. Every life is an individual gift from God, and no life is beyond salvation. None. And it is up to us here on earth to implement God's plan. And that's God not from any particular religion. But that is what I believe is what should motivate us, in part at least, to do what you're doing. Which is that, you know, there but for the grace of God go I. We all know that. Catherine was living a much different life before she slipped and fell and got on those pills, and life went another direction. What I said to another client I met a few weeks ago, though, was the great news about that is that you know life can move. So if it moves in that direction, it can move in the other direction too. And it's not static. It's not something you're stuck with. It's not something you have to live with. It's something, or die with. It's something that you can change. You just need people to help you do it, and the resolve that Catherine's shown over the last year to use those tools to help her stay sober.
Thank you.
right?
Thank you.
And
My
have-
tools are right here, you
Yeah.
know.
And that's, right, what a gift.
Exactly.
What
I feel
an enormous gift.
extremely lucky to have, I didn't even know, I mean, I didn't get food tips. I had no idea about the system when I came in the doors, and they have just been nothing but wonderful.
And that's the gift. And for all of you, I know you feel this or you wouldn't be here doing this, but what an extraordinary career. To have an opportunity to be a gift to someone and change their life for the better as a result. You know, that's worth a lot. It's worth a lot.
Yes,
And I'm
it is.
sure that each one of you have your frustrations and your misgivings on certain days around here, because I'm sure there's some days where there's some people who challenge you in a way.
Oh, yes.
No. But when those things happen, you just go to Wes and he makes it all better, right? But with all that, I'm sure there are also moments of extraordinary exhilaration and triumph when you see someone succeed. So we're going to try to help you do that, help you do more of that. And you are the instruments to get that done. And I'm really proud to be here with you and to hear your stories and to hear what you're accomplishing for yourself and for those that you work for every day. So keep up the great work. And as a Morris County resident, I'm really extra proud. Right? You know, living in this county is a great place to live, but we have our problems too, and to have people who are willing to stand up and address those problems in a really upfront, direct way like you are, you're doing a great service to the people who live here. And so as one of those people, not just as governor, let me say thank you for what you do, and you will hear from us again.
Thank
And
you.
we'll continue to support you, so thank you all.
Thank you.
And let me come by and spend time with you today.
Thank you for
It will
coming.
definitely be the best part of my day, I guarantee you.
Thank you.
Thank you all.